We can all learn some lessons about healthcare from a former professional athlete who had a serious accident and ended up in intensive care. Cyclist Phil Gaimon was left on the hook for about $150,000 in medical bills, even though he had double health insurance. He crashed during an Olympic qualifying race in 2019. We're examining unexpected medical costs as part of our continuing Bill of the Month series in partnership with Kaiser Health News and NPR.
Phil Gaimon's qualifying Olympic race ended with a crash when he collided with another cyclist. He was thrown from his bike at about 40 miles an hour, breaking 7 bones. Gaimon was rushed unconscious to a nearby ER room at Lehigh Valley Hospital in Allentown, Pennsylvania.
So when I woke up, it was excruciating pain. I'd broken all the ribs on my right side, my collarbone, and my scapula, my shoulder blade.
Gaimon received collarbone surgery at Lehigh Valley and a second procedure on his shoulder bone at the Hospital for Special Surgery in New York.
Both of the surgeries were completely necessary. I was just in tremendous pain all around.
He made a quick recovery at home, but then the bills came. They totaled over $200,000 from both hospitals. His 2 insurances paid a total of only $52,000, leaving him on the hook for about $150,000. He realized Lehigh Valley Hospital was out of network, and his scapula surgery was classified as an elective procedure instead of an emergency, which could have saved him money.
They hit you with the bills when you're literally least capable of handling anything. I get a stack of bills every month. I get collections notices every day.
Gaimon has spent months calling and writing letters to his primary insurance, HealthNet, to persuade them to cover more of the bills, but he's been unsuccessful. HealthNet said that it's committed to providing high-quality care with a large choice of in-network providers, and that members should contact them for assistance.
This could happen to anybody at any time. Where you can just wake up in a hospital and then later find out you owe them $150,000. I wish I knew that getting health insurance was still essentially a gamble.
Lehigh Valley Health Network told Kaiser Health News that they have no record of Gaimon trying to contact them about financial assistance and that they would be happy to discuss a mutual resolution of his outstanding balance. The Hospital for Special Surgery said they reached out to Gaimon to help resolve the dispute about the surgery classification and will continue to advocate on his behalf. Joining us now is Dr. Elisabeth Rosenthal, the editor-in-chief of Kaiser Health News. Dr. Rosenthal, thanks so much for being with us. How common are some of the issues that Phil experienced?
Well, as we know at Bill of the Month, hospital billing is filled with landmines, and Phil hit 3 of them. Out-of-network hospitals, high costs, and here's the biggie in his case. Insurance from one state often doesn't work very well in another.
So what are your tips for an emergency situation like this?
Well, what happened to Phil is he got hit with something called balance billing, and it's a type of surprise bill. You go to a hospital that's out of network, and according to all the surprise billing laws that many states have, you're only supposed to be charged in an emergency what you would have been charged at an in-network hospital. So Phil's insurer, which was California-based, paid what it considered a reasonable rate. Both hospitals wanted far more, and they balance billed Phil for the difference. If he'd been in California, which has a good surprise billing law, that would have been illegal. But because he was in Pennsylvania and New York, and insurance is state regulated, they could do it.
There are new federal protections. Sorry, go ahead.
Yeah, so there are some things you could do. Of course, Phil was unconscious, so you're
Exactly.
not in a place to be a savvy healthcare consumer. But if you are still awake, you can ask to go to a hospital that's in network. When they ask you to sign those forms that say, I'll pay for anything my insurance doesn't cover, you can add in as long as it's in my network. And you have a choice. If an ambulance comes to pick you up and you don't think you need an ambulance, you can say, I'm not getting in.
Yeah. Well, that's a tough choice to make. Dr. Elisabeth Rosenthal, thank you very much. We'll be right back.
Thank you.